Good morning, St. Louis. Good morning. Oh, you really playing with me. Good morning, St. Louis. Good morning. Oh, these are my people. Like usually I have to tell myself to behave in the car before I come and talk, but today, these are my people. So I don't think you can begin any snapshot without telling your story. And I say to you as leaders in this room, be unapologetic about knowing that your story informs your leadership. So I'm going to take 1 second here to tell you how a young woman from Harare, Zimbabwe, is now the director of health for the city of St. Louis. Woo! I was born in the beautiful country of Zimbabwe that sits on top of South Africa, landlocked, about the size of Arizona, about 14 million people. The heroine of my story is on the screen. This is her taking me on one of her many trips on the tube in Gatwick. We were in London together because she benefited from our new state of independence in 1980. And I remember a first picture of my mother standing outside the first plane from Zimbabwe after we gained our independence, with her fro just framing her face, and as the youth say, snatched for the gods. And that war had been won by people like my father, who was snatched from his village at the age of 11 to fight the war for independence against our colonial masters, the British. And because we didn't have the same level of artillery, not only was he removed from his village at 11, but he was sent to China to learn guerrilla warfare because that was the only strategy that we had. Many people who meet me today and talk about my late father say, don't even know his real name, the name on his birth certificate, because our war veterans were given the names of Chinese generals. So people will say to me, "Diwe mwana wa Comrade Mao," which means you're Comrade Mao's daughter, aren't you? That's how people know my father. So when you talk about my leadership style and my unapologetic need to center equity and justice in everything I do, it's in my DNA. So then my mother packed her only child on a plane at 18 years old to come and get my undergraduate training here in the United States. And I say when my mouth, because if you know me, you know it's only a matter of time before this mouth gets me fired, child. But if it ever happens, I'm gonna sell the script to Hollywood of the 2-day Greyhound bus ride from DC to Springfield, Missouri. Springfield, Missouri, the 9th whitest city in the United States. So that cultural shock was like no other. In Springfield, when you're walking down the street, cars slow down with black people and they ask you, "You okay, baby? You all right?" And they mean it, like they really doing a check-in with you. Yet and still, one of the most nurturing environments I've ever trained in, a high school in one of the whitest cities in the United States. Because thereafter, from my medical training to my public health training to my infectious diseases fellowship, I was tokenized. I was not sponsored or mentored with intention. And my career was not equitably advanced and promoted. I became a shell of myself. This extroverted child born of freedom fighters in Zimbabwe tried to be something that I never was. See, I was unapologetic. I told them where I was coming into medicine. I wanted to be an ID doctor with public health expertise so I could help my people through one of the biggest epidemics of our time, the HIV/AIDS epidemic, that saw Zimbabwe as one of the top 5 countries where people got and died from HIV and AIDS. But that was not my experience in the halls of academia. And so I found myself 7 months pregnant, a whale child at the beginning of this new global pandemic, the COVID-19 pandemic. I was the only black woman in my division, and I was the only pregnant woman. And at the time, my division chief, this is when we ruled the land. Oh, you don't know nothing about us in the hospitals, but when it's Ebola or Zika or COVID-19, baby, that's our time to shine in infectious diseases. So I said, of course my boss will see me now. Of course I'm gonna be given a seat at the table. Oh, baby, he was like Oprah at the time, just you get a leadership position and you get a leadership position and you get a leadership position. And yet and still I didn't get a piece of the pie. And that's when I woke up. A few weeks later, Maternal Child Health Week, Black Maternal Fetal Child Health Week, told me that I was 3 times more likely to die than my white counterparts just by virtue of being black. The stress had me have our second baby girl early. And within that halls of medicine, I understood for the first time how my privilege as a physician who could advocate for myself saw me have better outcomes than black and brown women. We had our baby in COVID. I was breastfeeding every 2 weeks. We had, every 2 hours, child, the baby would just howl. The baby was on a diet, child, and y'all just let me have it. Like, y'all really just stood there quietly and said, oh, yes, you did, to every 2 weeks. I need us to be more honest with each other. Okay. So drink your coffee, honey, because this ain't it. Like, we really was feeding the baby every 2 weeks. Wow. Every 2 hours, I had a 3-year-old in the house. They wouldn't let our parents come. My entire family is back home in Zimbabwe. And then George Floyd was murdered. And as a new mother, how could I watch the video? I was bearing my own trauma in my own home, trying to feed my child. But a couple of weeks into it, it was around midnight, my husband was snoring next to me. I fed the baby, put her in the bassinet, and I watched the video. And I saw yet another black man cry out for his mother, murdered in broad daylight. And so we hear about how careers suffered during the COVID-19 pandemic. Oh, I rose like a phoenix. Because in the safety of my home, with my husband, a he for she advocate who reminds me who I am every day, with my babies who are my reason for existing, I was able to formulate a plan. And when I came out of maternity leave, I was unapologetic. When the news agencies called looking for people with expertise in COVID-19 and I was punting to old white men in my division, a shell of myself, you remember I had really shrunken into myself, I said yes. Within a month, I went from local news to CNN. CNN producers are fancy, baby. They really think they something. So when they call you for your first time on CNN, it's a little bit of a lecture and they're like, hello, I'm the producer from CNN. I don't know what this accent is, but just work with me. And they said, and we expect that you wear your hair slicked back, and we expect that you will wear pastel colors. And I said, yes, I will. And I said, baby, listen, on this live news channel, when I say racial equity and blickety black too many times, they're never gonna have me back. So baby, your girl showed up, fro picked out, Prince on deck, right? Woo woo! And I talked about how offensive it was to see people with this righteous indignation about these disparities that said my community was 3 to 4 times more likely to get COVID, to be hospitalized from COVID, or to die from COVID. And it wasn't the statistics that got me. It was the, oh my God, what? Because anyone who does this work knows that is a copy and paste across all disease states in medicine and has been so for decades, right? So I became the representation I didn't see. There were no women, there were no black women, there were no black women immigrants on the news, and they certainly didn't come with the excellence and the expertise that your girl has. Within 6 months, I resigned from academia in self-advocacy. They told me my career was over, but baby, when the first black mayor for the city of St. Louis called, and not because I saw the job description, but because when I was being overlooked, when I wasn't being given those opportunities in academia, I was in community, doing the work. And it was community leaders that called her and said, we want her. So when she called, I answered and became your first black female physician for the city of St. Louis. Woo! But public health was in disarray. I live in a state whose politics do not support the work of equity, right? I inherited, as did my mayor, a budget that wasn't in a pandemic, right? Public health is leading the way. You got an ID doctor with a public health degree who is trained at the best institutions as your health director. What % of the budget should the Department of Health have at this time? Come on, let's be aspirational. Throw out some numbers. 15%. Come on, 15, hopeful. Let's go down, honey. What we got? Huh? I heard a 3, baby. I would be swimming if I had 3, just swimming in money. I inherited 1% and I'm sitting at less than 1.
Wow.
If you look at this graph on the screen, Missouri is the black line right at the bottom, honey. Because in a 2021 survey, we had the lowest per capita spending on public health. In this state, we say that your life is only worth $7 per head. $7 per head. I came with my squad. I didn't know if y'all would like me, so the homies are in the front right there. Boom, 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 baby. Oh, but I still had lofty goals. My first staff meeting, I was gonna do shared missions and vision. We were gonna talk about some stuff. But my team were traumatized.
Yeah.
They said on repeat, we are underpaid, undervalued, and burnt out. On repeat. So while my externalized priorities had to be COVID, I didn't have a choice. I was a month away from the biggest surge of the pandemic, the Omicron surge. We had forgotten the rest of medicine. We know violence prevention has to be a priority in our city. We know that behavioral health was a crisis before the pandemic and increased exponentially during the pandemic. We know that our maternal child health indices in this state are at the bottom 5 every single year. But I didn't have the luxury of just dealing with that. Everything was on fire. But I had to internalize my priorities, which is my first message to leaders in this room. If you aren't taking care of your team, if you don't make sure that people that walk side by side and make you look good, because I get to be on the stage, but it's Tyrell that is leading, ending the HIV epidemic every day. Woo! Do you understand? He makes me look good.
Yes.
So I had to focus on value building, culture building, and infrastructure setting. And everybody knows this diagram. My baby Tyrell actually showed it to me for the first time. So when the mayor interviewed me, it wasn't an automatic yes, because I needed to know that our priorities were in sync, that she would allow me to unapologetically lead with equity. Because for all of how tired the people in this country, baby, I almost said it, but you see I brought it back. I'm okay. We okay. Because the reality is our communities don't get to benefit and thrive in the same ways. So equality tried, baby, but she failed. No, I'm not going to prescribe it to she. He failed. I'm going to give it to y'all men. And did some all lives matters, everybody's struggling, so everybody gets some. Nah, we have to unapologetically bring the same disproportionate resources, funding, and policy to those communities until we see liberation. So while I make that look fancy on the stage, this looks very simple. In the places that y'all lead right now in your offices, this looks like quarterly section meetings. Because I always meet with my executive leadership team, but no director of health was really meeting with their huge organization. So quarterly, my schedule gets cleared. The leaders and supervisors leave the room. I feed my staff, we turn the tables inwards, and they get to talk directly to me. This looks like building QI and EPI, because Dr. Corey Bradley taught me that data is justice. So when I only had, and he's in the room, by the way, stand up. So when he taught me that, and I only had 2 epidemiologists for the whole city, we've now increased that to a team of over 10. Woo! Because baby, I'm not gonna argue with you for too long, honey. Like, we can be at a meeting and we can go back and forth, but baby, they call me Matifadza, keep a receipt, Hlatshwayo Davis. So my epi team keep me stacked with the data. We just slide it across the table. Now, what we gonna do? And it was at that point in developing a QI team where we're constantly looking at our programs. Those programs are informed by data. And when that data is led by a woman who unapologetically centers equity, it means that they are trained and are innovating in health equity indices. Do you hear me? Okay. We did a survey my first year to look at how my staff felt their leadership was doing in the Department of Health. And we activated We activated my internalized priorities. A year later, we increased every single metric by 9 to 35%. Wow. The staff felt seen, the staff felt heard, and Tyrell will tell you, it ain't perfect. Oh, baby, the health department is a sad, sad little place, honey. Okay, we are city government. We are civil servants, okay? There's nothing cute and happy and corporate America and resource driven, but I inherited chaos and we moving up.
Yes, yes.
Woo! And then we talk about innovation. This is Tyrell Manning's work right here. It's about finding unapologetically leaders who also center in health equity and then giving them the space to move. So Tyrell came on board and he saw, we didn't have budget, honey, I already told you that. I don't have resources. My health department is a quarter the size that it should be. So he got innovative, and we implemented a Take Me Home program, understanding the people living with HIV, something we should have eradicated in the #1 superpower in the world. We announced HIV in this country in 1985. We have pill options, we have injectables, we have billions with a B, of dollars in research, and yet we still live with HIV right now. So this leader, this man right here, implemented this program, brought innovation, brought a whole new website, the healthstopstl.com, check it out today, and brought tests that people can have the dignity to take in their own homes. Why? Because he understands the valid mistrust and distrust that Black people have for government and healthcare institutions. He knows that they are less likely to show up downtown at 1520, A, because they don't trust, and B, because of stigma. Stigma that we've allowed to grow and take over. So he said, we're gonna give them tests that they can take at home, preserve their dignity, right? Preserve their privacy, and then we're gonna build linkage to care, because he also understands that the social and structural determinants of health are another significant barrier. So this addresses transportation, right? His partnerships, strategic partnerships with the trusted messengers in the community that have earned the trust of these folks. Because while I sound good, and baby, I know I sound good. When I took this job, they didn't know me from a bar of soap. But they know E. Rise Williams, right? And they know the community-based organizations, the FQHCs. Can we give it up for our federally qualified health centers? They know them. In COVID, one of my largest clinic, community-based clinic, was in the winter. It was cold, it was snowing, and it was a church in North St. Louis. And Pastor Burke said, come, bring your vaccines, they'll come. There were cars around the block. And they came not because the fancy ID doc lady came with her entourage. They came because they knew Pastor Burke and they trusted him. So we lean into allowing our egos not to always make us the guy, but to lean into the folks that have earned the trust of their communities. Last and not least, we innovate right here at the Department of Health. We are currently working on the first ever health equity plan for the city of St. Louis. We will be partnering with my twin, my good sis, Dr. Kanika Cunningham, who you saw earlier. But we know that this work doesn't get done if we don't understand the deep-rooted history and current reality in our communities, which is why we have made the first ever partnership of its kind, partnering with the Regional Health Commission, born out of the Ferguson uprisings. CEO, Black woman leader in this room, Dr. Risa Rawlings, will be leading us in developing a health equity plan that no longer says that equity will be a tokenized Black person in an organization, given no budget, given no staff, but expected to make magic happen. It will be integrated into every aspect of my organization. So I leave you with, because I know I'm over time, baby. When I started this job, I knew I had to meet people where they're at. I do not enjoy social media, but I have a large following because that's part of the work. That's community engagement, right? That's speaking to people where they're at. And I had a couple of hundred followers, and within 6 months, I had 18,000. And I had a few viral moments. This was one of them. The day that I was announced as the Director of Health for the City of St. Louis, I posted this, and this is what I will leave you with. One day, I will tell my story in full. But for now, trust your instincts. Know your worth. Be brave enough to forge your own lane if it does not exist. Choose your mentors and sponsors wisely. But above all, do not be afraid to step into your purpose because it's absolutely beautiful here. Let us lead unapologetically on behalf of our people. And at a time where the Supreme Court told us that the work that we do does not matter, let us with intention disproportionately prescribe leadership funding and policy to the work of racial equity. Thank you for having me.